Hello everyone, I'm Dr. Rachna Gandhi, Wellness Expert MMTSL, that's Maharashtra Medical Tourism Services Limited. It's your gateway to affordable and holistic well-being of mind, body and soul. We offer you a hassle-free A to Z to A services for all your medical and wellness needs. Today, on the World Arthritis Day, we have our very own expert, Dr. Vishwajeet Chavan. He is a consultant orthopedic surgeon and consulting at Lifecare Nursing Home, Iris Polyclinic, and Bombay Hospital. Welcome, Dr. Vishwanath, and thank you for taking your precious time to come on our platform to throw some light and create some awareness about arthritis on this day, especially when we talk about shoulder arthritis, which I think people are not very aware. Because when we talk about arthritis, people consider it to be knee arthritis. So can you please throw some light on shoulder arthritis in this session?
Thank you so much for the introduction. Ma'am, yes, this today is being a World Arthritis Day. So always people think about the knee arthritis and the hip arthritis. But primarily the knee arthritis is the primary consideration in people who suffers commonly with the knee problems. But always we forget about the shoulder. So shoulder is one of the largest joint which also affect by with the arthritic problems. So basically it is a basic complex joint which it is a commonest joint, the third commonest joint of arthritis which affect in the older age patients. So if we consider, there are various problems or various causes who cause this arthritic problem in the shoulder joint.
What are the most common causes of shoulder arthritis?
Most commonly, it is affect due to the previous history of the trauma, which is causes due to the high velocity trauma, which there's a head of the shoulder. It splits into 2 or 3 fragments, and it is an intra-articular joint. But we treat it with a plating method, but eventually it falls into the arthritis because of the wear and tear eventually. And the second cause is the age, degenerative changes, which is the commonest cause. And because of this wearing and tearing of the cartilage, osteoporotic changes in the joint. And the third cause is that the rheumatoid arthritis. In few patients who suffering with the rheumatoid arthritis, so they also get the shoulder arthritis, and which is always neglected by the patients and always treated with the conservative by the surgeons. Yes.
Okay. So what common symptoms we see? Because when we know that it's a knee arthritis, there is a pain, inflammation. So does shoulder arthritis also have the same symptoms? Or there is something specific when we talk about shoulder arthritis in terms of
yes, it's
symptoms?
Of course it's the same as knee arthritis. You get pain initially, but here is somewhat a little bit different than the knee arthritis, because the knee we always consider that it is due to the age. So after 60 or maybe 65 age, patient starts complaining of pain in the knee joint. But here is the scenario is different. Sometimes the patient may early start with the neck pain, and they eventually develop and also the trauma to the rotator cuff. So the rotator cuff is also important in that, which is always neglected by the most of the doctors, and eventually patient will get arthritis in the future.
Okay.
So
you would say there's more amount of referred pain is more in shoulder arthritis as compared to knee arthritis.
Right. Yes, exactly. So referred pain is always there in the shoulder, which we feel like it is coming from the spine, but it is not. It is always related to the joint first, and then it radiates towards the neck and the hand as well. And the second thing is that usually this pain gets in the during sleep. When you will sleep on the affected side, you will get pain. And when you will do any kind of activity like buttoning the shirts and combing the hair, this is very painful at that time, particular moment. So, and this is what the scenario in early stage of arthritis of the shoulder.
Okay. And could shoulder arthritis result into some bigger issues and a threat to life, like in a routine? Can it affect to that great extent?
Yes, of course. Shoulder arthritis is somewhat a bit a complex thing. We need to understand the anatomy and, of course, its mechanism of the biomechanics of the shoulder. But considering this biomechanics of the shoulder, which always patient is very discomfort with the daily routine activities. So, of course, but it is not life-threatening. We have some solutions for the shoulder arthritis: early solution, intermediate, and the later stage solutions. So it's not life-threatening. You can get cure with that problem also.
Okay. So can we diagnose it at early stage, or it only person comes to know when it is in advanced stage? When we talk about shoulder arthritis.
Of course. Patient, we can diagnose it early, but patient. Obviously, the patient will come with the pain of neck initially, and we shouldn't always be considering that it is coming from the cervical region, but it is also, you should consider that the pain is also coming from the shoulder joint, exactly, the acromioclavicular joint, or maybe the glenohumeral joint. With a different movement, you will, if you do the examination in the different movements, and then you will come to know where the pain is coming from exactly. And of course, the X-ray is the always primary diagnostic part in the orthopedic field. So if you see the X-ray, you will see some changes in the joint space, acromioclavicular joint space, as well as the acromioclavicular space. So there is a spur. There's the commonest thing is the spur formation in the joint. So far that you can come to know. And of course, in the advanced stage of the arthritis, you will need an MRI for that. So one has to get an MRI if it is chronic. But if it is if the pain is since last 6 months or less than 6 months, then of course the X-ray is the only early diagnostic thing in this process.
So is it possible that a person may have a cervical spondylosis and this shoulder arthritis at a time when he is complaining of a neck pain? Because the most common due to this digital world, people are having lots of neck pain. Even at an early age, everyone is complaining about neck pain. So do you think even shoulder arthritis could be a reason?
Of course. It may be not in the younger patients who is below 60 but above 50 years. But of course, we should consider that above 60 years of patients, or maybe more than that. But that this you can relate with that, of course, definitely.
Okay. And what as a preventive treatment you will suggest for shoulder arthritis? Because you always say prevention is better than cure. So is there any preventive treatment or a preventive solution for shoulder arthritis?
Yes, of course. It's the same as the knee joint. We consider that the first of all, some surgeons, they have a different protocol. Few surgeons, they always give them a physiotherapy. But my protocol is a little bit different, which I always stress on the changing the lifestyle of the patient, and a little bit of the diet, healthy food diet, homemade food diet. So obviously a patient also feels better to follow this command regularly. And the second part is physiotherapy. Obviously the physiotherapy is as important as the diet, because it helps you to strengthen your muscles and the ligaments. But the thing is, patient sometimes if patient don't follow, then obviously this goes in advanced stage. But I have seen few people who religiously follow the physiotherapy and they change the lifestyle a little bit for themselves, and they give a good result, and I can prolong their surgical procedure for the yes.
Okay. So what if a person doesn't have any symptom like shoulder arthritis, and he doesn't want that he should get a shoulder arthritis in future? So as an individual, what prevent? He can have a balanced meal. He can go with a proper exercise regime, and that will be sufficient for him to avoid getting affected by shoulder arthritis. And even I would like
of course
you to comment on what about gym activities? Does the person need to go for the strength training when we talk about weights? As like for gym comes like weight training, or only cardio is enough to keep oneself fit and fine as per joints are involved?
Right, absolutely, good question. Because I'm very enthusiastic about the physiotherapy of the shoulder joint, because it gives you 80% relief of the pain, even in the arthritic disease, or even in the some other problem of the shoulder. But if we consider today for the arthritis, I would suggest I categorize basically patients age between 50 to 60 and 60 to 70 and about that. But it is always depend on the stage of the arthritis. It's not only that X-ray would matter, but always the examination and the condition of the patient and the movement of the shoulder. It always depends on that. If the movements are free but it's painful at the terminal stage, then obviously I would suggest them to strengthen the muscles, to make their muscles strong, even in the gym, but not to lift the weights, because sometimes some patients may not carry this same scenario by lifting the weights. But the TheraBand exercises, I would prefer to suggest that, because it obviously concentrate on your muscles primarily, and of course the pain will reduce, because the mechanical load of any joint will reduce by strengthening the muscles. So I would suggest that. In the later stage, there are a few things I would inject in the shoulder with the steroids, and so that they reduce the inflammation in the joint, and the movement will increase eventually, and they will feel better. Again, they can do the exercises, TheraBand exercises, like that.
Okay. So can you throw some more light on the surgical aspect or the medicinal aspect related to treating this arthritis, especially shoulder arthritis? Like what, as in, if a person comes to you, what treatment, what part of treatment or line of treatment you guys follow? Like a person need to be scared, oh, I got a shoulder arthritis, or he can come with you that, okay, I'll be now all fine. What kind of treatment is being given normally in hospital?
Yes, normally a patient comes in very advanced stage of the shoulder, because it is not a weight-bearing bone joint, basically. So a knee is a weight-bearing joint. So obviously patient feels pain and when it starts at the first day. But in the shoulder joint, it may patient comes later. So we always have to start with a medical line of treatment, that is non-steroidal anti-inflammatory drugs, then the calcium, then the vitamin D3 supplements. So this can help them by all means to reduce by increasing the calcium levels and the vitamin to strengthen the bone, and the pain will reduce with that, of course. And then the second stage is advanced stage is always treated by the surgical method in the shoulder arthritis, because there is a reason why. If some patient asked me, sir, this is stage 3, and why we can't treat with the medication or physiotherapy? I said, after looking at his MRI, we found that there is a shoulder rotator cuff arthropathy, and that which is very dangerous even after to treat, because it's very challenging. It becomes very challenging for us to do the surgery as well. So that there are a few things we should consider before the surgery and after the surgeries. So even after the surgery, if the rotator cuff or the cuff problem is not solved properly, then might be patient will be unhappy throughout his life. But if we consider early stage of the surgery, then I think the 80 to 90% patient relieves their pain, and they can change their lifestyle too. They can they can comb hair, they can put a button on the button themselves, and obviously it will be a great relief from the arthritis of the shoulder. That's the thing. So advanced treatment, if you consider, which is hemiarthroplasty or the reverse shoulder arthroplasty, what we are doing right now on the patients.
So can you just highlight what do you mean by this arthroplasty to our audience, like in a
Yes,
layman language?
Yes, of course. It is same as the changing the joint, changing the cartilage. Instead of the cartilage, we fix the component with the steel material in the knee joint and the poly component on the tibia. It is the same thing which is in the shoulder, which is steel component in the shoulder stem as a shoulder stem, and the poly component in the glenoid joint. And of course, the life is good of that artificial joint. It can stays for more than 20 years if you do it in a proper way. It has to be followed by the American guidelines for that.
Okay.
So, and the arthroplasty is what a small short term is a arthroplasty. We change the joint, we change the cartilage, and we fix the component, steel and plastic component with that.
Okay. So it's quite similar to the TKI, that's total knee replacement, which people are aware of.
Same. Like exactly.
We replace a joint, so it's going to be like replacing a joint altogether, right?
Right.
Okay. And last but not the least, I would like to ask, what would be one takeaway message you would like to give to our audience? Like, that how they can prevent their arthritis, especially shoulder arthritis. The one takeaway, especially I have been seeing a lot of people who do regularly, routinely yoga and other exercises. So will that be helping them a lot, or they need to turn towards a gym? That's a big question people are always having related to arthritis, that yoga kind of activities are better or gym kind of activities are better when it comes to exercise or a physical activity. And your takeaway for today?
Yes. Takeaway. It's a very good question again, being today's World Arthritis Day. So I would suggest yoga is always better because it's an Indian ancient technique to better your health or to make your health wiser. So that I would suggest always the yoga to of any age. At any age you can do the yoga training, and you can do it at home or whenever you want. But gym training is always be a part. If you have pain or even the milder pain, you should not avoid, because it can change into the arthritis, because eventually, but it takes time, of course. But again, you will land up in the trouble, because it doesn't carry the body weight. But if you carry the weight, it always, the joint friction is always increased by 10 times. So I would suggest you that yoga is always better, who is suffering from the shoulder pain, and to continuing this shoulder yoga for the shoulders is always an option for the patients. And I should to avoid and please avoid weight training exercise. You can do cardio as much as you can do, and of course avoid lifting the heavy weights in these patients.
Okay.
Yes.
Thank you, Dr. Vishwajeet. Thanks a lot for sharing your valuable experience with us. I am sure that our audience will definitely get a takeaway message from this video of ours today. And thanks a lot
Yes.
once again for all your precious time. Thank you.
Thank you.
Thanks a lot.
Thank you so much, ma'am. Thank you so much. Yeah.